Okay, well, I think we are starting to get people settled in. Again, keep introducing yourselves as you're coming into the room. Welcome to our webinar, the Staff Family Child Care Networks as a Workforce Support Strategy. We're excited to have everyone here and really excited to have Shana Cook welcome us. So I'll pass it on to you, Shana.
Good afternoon, everyone, and thank you again for joining us today. My name is Dr. Shana Cook, and I am a Senior Advisor in the Office of Early Childhood Development. Next slide. The Office of Early Childhood Development, the Office of Child Care, and the Office of Head Start support staff family child care networks as a strategy for improving quality of home-based child care for children birth through school age. As a result, the interest in this approach has increased. And early care and education leaders, policymakers, and program administrators are seeking information about models of staff family child care networks that they can implement in their states and localities. The list of positive impacts that a staff family child care network can have is long. Here are just a few of the impacts. We are excited about all of the possible impacts listed on this slide, some of which include greater financial stability and sustainability, improved quality and enhanced child outcomes, and an increased number of licensed providers who participate in the subsidy system. I hope this webinar today will launch a conversation and activity around staff family child care networks. We look forward to watching your work, hearing about your successes and challenges as you build your supply of family child care providers. Now, let me turn it over to Laura Johns at the National Center on Early Childhood Quality Assurance.
Thank you so much, Shana. It's so great to have you here and to have you supporting this work. We can move to the next slide. So I just want to take a moment to say that, the Office of Child Care, the Office of Early Childhood Development, the Office of Head Start have been working really hard as a team to find ways to support the ECE workforce. And this webinar focused on home-based providers and the family child care professionals who really support many, many children on a daily basis from birth through school age. Some of the things that the Office of Early Childhood Development, the Office of Head Start, and the Office of Child Care have done together is establish a rapid response TA collaborative of all of the national TA centers, whether they're housed at the Office of Child Care or they're housed at the Office of Head Start. We work together with other technical assistance partners to really have a rapid response to the field's needs, whether the field is represented by state and territories or tribes, or whether it is resource referral agencies or networks who need additional resources. Through this partnership of the National TA Centers, we are doing monthly webinars highlighting early childhood education workforce innovations. We have a monthly e-blast that's focused on ECE workforce supports. And we have a beautifully curated webpage that provides you with resources, information, and soon we'll highlight strategies from all across the United States, the territories and tribes of how people are leaning in to support our ECE professionals. We're going to go ahead and put in the chat box links to our webpage, to the monthly e-blast, and we'll also put those in the chat box at the end of the session so that you all have access to these amazing, amazing resources. So again, I just want to make sure that we spend time and thank all the federal partners who are really watching our backs and making sure that we all have the necessary supports to make sure that our ECE providers have what they need to be successful for our children. Next slide. So I am super excited to have you hear from today's panel. Again, I represent the Early Childhood Quality Assurance Center, one of the national TA centers, but I work with many, many colleagues from the TA network to make sure that we have resources to bring to you today. I'm so thankful for Jennifer Drake to be here. Jennifer is the Director of Network Development at All Our Kin, a strategic partner with the Quality Assurance Center. I'm excited to have Elizabeth Gunny here. She's the Deputy Director of Women's Housing and Economic Development Corps in the Bronx, New York. And also having Travis Claybrooks here, the CEO of Rafa Institute and overseeing the Early Embrace Project in Tennessee, in Nashville, Tennessee. And I just can't tell you all how amazing it is, the work that both Elizabeth and Travis are doing. Elizabeth, who has a project that is really in full implementation around supporting family child care home-based providers, and Travis, who has stepped into the deep water and it has an emerging program that has so much promise. I know he's keeping his head above water. Thank you, Travis. But these are amazing, amazing projects, and we're hoping that they are bringing you information that you can learn from. We hope you ask a lot of questions in the chat box, and we look forward to additional conversations with all of you on the call about how to make sure that we are supporting family home-based providers as they care for young children. So I am going to turn it over to you, Jennifer, to kick us off and review the agenda. But I want to quickly just do a quick poll, if that's okay, Jennifer. A quick poll about who's in the room. So I'll ask Tatiana to launch that poll. I am really interested in understanding who's in the room and whether you are involved in implementing a staff family child care network. Maybe you're just beginning to get a network going. Maybe you're kind of here because you're considering what it would look like to implement a staff family child care network. And maybe you're here for another reason. So the first poll is kind of what phase are you in when thinking about staffed family child care networks? And that second question is maybe you're here because you're a provider who's involved in a network. So we would love to hear a little bit about that as well. So I'll let you all quickly do that poll. And then Tatiana can share the results with us. We'll get a little hint of the audience in the room. So Tatiana, when you're ready, we can launch those results. Okay. So about 33% of the people on the call are considering implementing a staff family child care network. So we are here to convince you that it is a good investment of your dollars, a good investment of your time and energy, and a good investment for the family child care providers that are in your states. So that's exciting to hear. And we do have a few providers on the call. So provider voices, get in that chat box. We definitely want to hear from you throughout the call. So thank you, Tatiana, for that poll. And again, Jennifer, I'm going to turn it over to you.
Thanks, Laura. And hello, everyone. I'm Jennifer from All Our Kin. All Our Kin operates staff family child care networks in Connecticut and New York. And we train and advise partner organizations across the country who are planning and implementing their own staff family child care networks. And as Laura mentioned, in that latter capacity, we're a proud partner of the National Center on Early Childhood Quality Assurance. We have a packed session for you today, starting with grounding our conversation in a research-based definition of a staff family child care network. We'll explore staff family child care networks as a workforce support, and I'll share about All Our Kin's network as an example. We'll hear from Elizabeth and Travis about their networks. We hope to have some time for questions, and then we'll close with a few additional resources. As early childhood professionals and interested stakeholders, we can enhance ways of collaborating with one another when we have a shared understanding of the terminology we use. So we'd like to begin by building a shared understanding of what we mean by staff family child care network. In the 2019 Mapping the Family Child Care Network Landscape, findings from the National Study of Family Child Care Networks, researchers Brommer and Porter defined staff family child care networks as organizations that offer home-based providers a menu of quality improvement services and supports, including technical assistance, training, and/or peer support delivered by a paid staff member. The resources and examples we're going to spotlight today are aligned with this definition. As Sheena mentioned, research about the impacts of staff family childcare networks is compelling. And even though the research base is relatively small, staff family childcare networks are emerging as a powerful workforce support strategy for addressing family childcare retention, recruitment, and compensation. And as you may know, staff family childcare networks can be funded with CCDF quality set-aside dollars and other flexible dollars. And networks are named as an allowable supply building strategy in the ARP Act guidelines. Now, All Our Kin is one example of a staff family childcare network. I mentioned in my introduction that through our direct service work, All Our Kin operates networks in Connecticut and New York. Our approach is holistic, responsive, and values-based. Our model is represented in the 5 critical components and guiding principles you see here in our graphic. We directly serve over 1,000 educators who in turn provide care and education for more than 6,000 children. All Our Kin is one of the very few networks to have been around long enough to have a solid research base on our model. And here are a few highlights that show how All Our Kin networks impact retention, recruitment, and compensation. Over a 10-year period, we reversed a troubling nationwide trend of decreasing supply. In the cities in which All Our Kin operates, we increased supply by 74%, while around us, supply fell. And in terms of retention, a study of All Our Kin found that 50% of educators in All Our Kin networks intended to stay in the field of family childcare as long as possible, compared to 7% of providers in the comparison group. And in a study of our licensing program, over 50% of licensing toolkit program graduates went on to achieve an associate's degree or a CDA credential. Our networks have an impact on compensation. Family childcare educators in All Our Kin networks earn $5,000 more after 1 year with us and $10,000 more after year 2. And each family childcare program enables 4 to 5 parents to enter and remain in the workforce. Our program has significant macroeconomic benefits as well, largely due to increased workforce participation and tax revenue. If you'd like to dig into these findings and learn more about our model, you can find citations and more on the back page of our network framework linked on the slide. And yes, Jennifer, I can put the framework link in the chat. I'll do that shortly. Thanks for the question. So here's a special workforce project that we wanted to share highlights as a partnership between workforce programs and staff family childcare networks. And I saw some Connecticut folks say hello in the chat. So hello to you. In 2020, the Governor's Workforce Council in Connecticut allocated $15 million of the state's coronavirus relief fund, which utilized CARES Act money to workforce programs. And $5.3 million of these funds were used to support the Connecticut Office of Early Childhood in partnering with All Our Kin to train and license an astonishing 106 family childcare programs in the fall of 2020 in the midst of the pandemic. All Our Kin supported the OEC in rolling out a statewide licensing support toolkit program. We trained, advised, and provided licensing toolkit support materials to Connecticut's 12 staff family childcare networks. We sent 150 boxes of startup materials to local networks who delivered them to family childcare educators. And All Our Kin also facilitated childcare licensing orientation within the networks. Thanks, Ashley, for the link. This increase in licensed family childcare allowed OEC to partner with workforce development boards to quickly connect families with childcare as businesses began to reopen across the state. And this toolkit licensing program continues to build the supply of family childcare in All Our Kin networks and across Connecticut. Providers' earnings increase, they gain pride and professionalism. They're able to serve more children and serve them better with the equipment and training they need to provide safe and educational childcare. So that's a bit about All Our Kin Staff Family Childcare Network and workforce supports. Please keep in mind, as do we, that our way is not the only way. All Our Kin's model is not the only model. There are many ways to implement a network, and there's lots of innovation happening across the country. And now I'm delighted to introduce you to folks from two other great networks doing innovative work. First, we'll hear from Elizabeth and then Travis. Elizabeth, welcome. Thank you for joining us today. Please introduce yourself and tell us about WEDCO's Staff Family Childcare Network.
Thank you, Jennifer. It's a pleasure to be here. My name is Elizabeth Gunny, and I serve as Deputy Director for WEDCO's Home-Based Childcare Program. So for over 27 years, WEDCO's Home-Based Childcare Program has been equipping childcare providers to start and grow businesses that thrive. Most importantly, these businesses have been keeping children safe, healthy, and vibrant. We work with a vast network of licensed providers all over New York City. We provide professional development for these childcare providers while also supporting them in their efforts to do two things: to sustain their childcare businesses and to ensure that the children they serve flourish in every way. Now, this support includes connecting our network providers to helpful resources like free training through our training institute, as well as to the Child and Adult Care Food Program. Through a contract with New York City's Department of Education, we also serve a group of highly skilled early learning providers who are subcontracted by us to provide care for ages 0 to 3 years. This group of providers, what they do is they work to provide a standard of care which is comparable to their counterparts in the 3K programs. While we are contracted to recruit, pay these providers, and also support their respective recruitment and retention of children in their programs, we serve them also by providing coaching and other professional development opportunities that they might need to help them succeed in their work. As part of our work with this group of childcare providers, we also help them create space for family engagement in order to ensure continuity of care in their programs. Like the first group of network providers I spoke about, this group of early learn providers also get access to all of our training and coaching resources. Now, a third group of providers with whom we work are informal or legally exempt childcare providers. As the sole enrollment agency for informal child caregivers in New York City, we have the task of enrolling these informal child caregivers into a statewide system for payment and tracking, as well as for inspecting their homes to verify their compliance with New York State child care. Now, in line with our goals as an agency for our home-based childcare program, our work with the informal child caregivers does not end just with inspecting for compliance. In fact, we also ensure that just like the formal caregivers who get support from us, all informal child caregivers receive the same coaching and the same technical assistance they need in order to become thriving home-based childcare businesses as well. Additionally, it's always our goal to ensure that our caregivers, both informal and formal, grow in their capacity as early childhood educators as well. So how do we do that? Well, our Trusted Training Institute works to provide training for all caregivers with whom we work. We are serious about strengthening the skills of our caregivers as early childhood educators. So we offer classes on topics that are specific to things like trauma-informed care, curriculum development, child development, nutrition training, amongst others. And as far as nutrition education is concerned, our child and adult cared food program is open to both informal caregivers and formal caregivers. And through this program, they receive more training, nutrition education, coaching. They're also encouraged to learn how to incorporate active play skills in their programs. So in all of these ways, our training institute, our CSCFP program, our coaching teams work in tandem to support all the child caregivers with whom we work. I'm happy to answer any other questions you might have. I'll also put my email address in the chat box if you have other questions. Thank you very much.
Thank you for that summary, Elizabeth. I'll pause here, Laura. Do we have time for a couple questions for Elizabeth, or yes?
I think we do. Let's pull back to that slide, Tatiana, and also don't hesitate to put your question, go ahead and put your questions in the chat and we can read them from the chat. I think one thing that I'm really excited about as I was hearing Elizabeth talk is this idea of remembering those legally exempt providers, remembering those providers who have not moved through the licensing process and supporting them to move under a compliance umbrella, since that really not only supports their professional growth, it also allows them to even access more supports for their for those children. So I love that they're really working at the top of the system and the bottom of the system to move everybody into kind of an equitable standing in this profession. So any questions that we have in the chat box? I don't see any right now, but as people are thinking about them, please don't hesitate to add them to the chat. Jen, did you have any questions?
Yeah, I'd love, I'm really intrigued by the contracted slots component of your program. For all our kin, when we think of contracted slots, it really happens in our early Head Start program. Can you say more about that part of your work, Elizabeth?
Yes, thank you, Jennifer. Yes, so this is what we call our early learn network of childcare providers. So yes, we are contracted by the Department of Education to then subcontract this group of, there are about 45 providers who are in turn caring for a little bit over 300 children in their homes. And so our role is to recruit them, train them, support them, and then help them in their work. We have on staff teams of inspectors who go into these homes to confirm that they do comply with the rules of childcare. But additionally, with this group of child caregivers, we also offer support for them to do things like do accurate, to observe the kids and the children in their care, to identify areas where they might need early intervention. We also offer them support to do parental engagement so that they will continue to have the same parents and children in their care for the long term. So this group, this is a very, and I should add that this is a group of highly skilled child caregivers. They are required to at least have a CDA in order to be a part of this program. And so we support them also to receive more trainings that they need in order to strengthen their skills as well.
Elizabeth, we had two questions that popped into the chat box. So I'll give them both to you first, and then maybe if you could take just a minute or two to answer those, then we'll move on. So the first was about outreach, because I think a lot of people recognize that it's sometimes difficult to have people come forward and say, I'm caring for children in my home and I might need some help. So how do you outreach for informal, unregulated care? How do you find people and locate them? And then we had another question around the tactics around working with licensed exempt providers in meeting state and federal training requirements. And so what are some of the things you do to make sure that people are receiving those required trainings?
Thank you. So with the legally exempt informal childcare providers, the outreach is actually happening before they get to us, because through our contract, we get to be stationed at HRA offices all over New York. So whenever a parent comes in to apply for care, before they even get to us, in New York City, a parent gets to choose what type of care they want. So before they get to us, if they opt to have an informal caregiver, an aunt or an uncle, a grandparent do the care, the HRA associate would give them the application they need before they get to our teams of people who will then review that application with them and then enroll the informal caregiver they've chosen. We do find that oftentimes parents opt for that friend or that aunt or uncle if they know that they have that choice. So that outreach is done before they get to us. Also, as far as tactics that are being used to encourage informal caregivers to get the trainings that they need, in New York City, there is an enhanced rate of pay for legally exempt caregivers if they do take a set training. So if they take 10 hours of classes, their pay increases. So that's the first hook for a legally exempt caregiver who would like to get paid more. They understand that we tell them through our interactions with them at enrollment and also during the time that we come into their homes for an inspection for compliance, that if they do take these classes, they get a chance to be paid at a higher rate. Additionally, our teams of inspectors are trained to not just come into a home to check for compliance, but to look for areas in which they can be a coach. So we always say, we're coming in as a coach and also a cop, helping them understand different areas in which they can come into compliance and then also gain more for their programs. And so because we offer free classes for all caregivers, we always make that a part of our inspection, going over the classes that they could take to increase their skills, and to help them grow in their businesses.
Thank you so much for that. Travis, I think we'll throw it over to you to hear about the work at Early Embrace. So next slide, Tatiana. Thank you.
Well, good morning or afternoon, depending on where you are. I am in Central Time and maybe others are elsewhere. My name is Travis Claybrooks. I am the CEO of Rafa Institute, and we lead an initiative called Early Embrace, and so excited to be in space with all of you here. Thank you for allowing, first of all, this platform, Jennifer, Laura, and all, and for all those who are here. Thanks so much for being here. I want to really to help you understand what we're initiating here in Nashville. It's important to understand our why. Rafa Institute is a multi-service organization that is looking at what are the root causes of social harm and how do we begin to solve them, right? 4 years ago, we started a restorative justice diversion program in partnership with our juvenile court, where we were working with young people who were criminal legally involved, had caused harms in the community, and we did kind of repair and restorative work with those young people and the victims of their crimes. What we observed over time, something we already knew, we observed that 100% of these young people coming in through the criminal legal system as teenagers got poor or very poor early starts in their pre-K years. They were coming from communities that were disparately outmatched when it came to finding resources, finding access to high quality early learning or any early learning at all. They were impoverished. They are impoverished communities. They are geographically isolated, economically isolated, poor healthcare, poor education access. And so we decided, what if we could work upstream 10 years into the future, if you will, and begin working with children, prenatal to 4, and could we change the outcomes of what we see in our juvenile legal system? And so that was our working theory. And we said, yeah. And not only could we change those outcomes, but could we also work through the door of early learning to help transform the entire community, what was happening in the community, the entire ecosystem. And so we launched out early on to say, you know what, let's just go into some of the projects and let's just start early learning centers in those spaces. And as we kind of walked down that road, we became aware of something that we kind of knew but just hadn't thought about, and that was, hey, there are people already in these neighborhoods that are already keeping kids. In fact, mostly Black women, mostly single moms, already keeping kids. What if we could tap into that resource that's already there, to that infrastructure that's already there, and we could actually really get at the challenge that way? And so this became the seed for kind of rethinking our entire strategy. And so we began to engage with women who were already keeping kids. And we came across this model in our kin, and there's this thing of creating network and structure. And one of the things that we also observed and knew, that most of these providers, just about all of these providers, were severely under-resourced economically, didn't have access to even the knowledge base around high quality curriculum and education and offerings. They really knew very little about running a business or having a sustainable business. And so we said, you know what, let us be a bridge to tapping into or helping to connect these providers to the resources so that they could actually transform their own community and continue to provide more excellently early learning resources to the children that are in their community. And so Early Embrace was born. Early Embrace is this effort to really help transform impoverished communities through the door of early learning. We connect with early learning providers, and we essentially provide five things through our network offering. And that is licensure, coaching, and support. What does it look like to help a provider move towards the space of licensure? And really to do that in a way that reduces the antagonism that can naturally exist between a provider and the state agency, right? That kind of tension that says, you know, we're going to come in and we're going to police your business and make sure that you're doing what you're supposed to do. But instead, how can we be an advocate to help them, one, understand what the licensing process can look like, and then two, advocate for and walk with them through the licensing process, helping them in that process. And then three, what does it look like to then access the benefits associated with being licensed, right? So providing a continuum of support in that space. Secondly, pedagogical coaching. What does it look like not only to simply provide daycare, but what does it look like to have a high quality education offering for children who historically have been least likely to access it because of either transportation issues, having it close in to my neighborhood where I live in the projects, or even if it was in my neighborhood, being able to afford it, right? So what does it look like to have an auntie, a neighbor, a friend, a family that's in the projects providing Reggio-styled early learning, providing Montessori-styled early learning? What if the waiting list, the place of choice in the city for high quality early learning was in the projects? Oh my God, that would be amazing, right? So that's what we're thinking. What, can we make that happen, right? So providing that ongoing pedagogical coaching, business coaching. What does it look like to be a entrepreneur? Like moving from just I just keep kids, or I'm just a babysitter, or I'm just keeping my niece and nephew and my kids, to being, no, I am an entrepreneur. Yeah, I live in the projects, but guess what? I am a businesswoman, right? So people, once again, who are least likely to have access to the kinds of resources to be a business owner, suddenly being business owners, right? And doing that well. What does it look like to have all of the business aspects and education of running an early learning center, right? And then the last two areas really are around funding and helping to level the economic playing field of being an early learning provider. So we're thinking about, hey, I'm interested in doing this. I want to do this. I lost my job during COVID, and now I'm at home. I'm keeping my kids. What will it look like for me to shift into this space? But I really don't have the resources to get started. What would it look like for us to provide startup funding for such a person? What would it look like? I've been doing it for a few years. You know what? I got stuff that's old. I need to replace some things. What would it look like to have enhancement grants for women who are already doing it? And then finally, guaranteed basic income. I live in the projects. The cost of doing this really well compared to what I'm able to actually make doing it, because of the neighborhood that I live in, because of the economic conditions that are surrounding me and the people that I serve. What if we could close that gap? Right? And provide guaranteed basic income unconditionally to people who are either looking to get started or who are already doing it. We believe if we can do these things, that we could radically transform the lives of young people who are least likely, children who are least likely to get high quality early education, and who are most likely to be on a cradle to prison trajectory. We want to upend that. We want to change that. We want to uproot that. This is Early Embrace. This is the work of Rafa Institute. We're excited to be going at it, and so excited to be in space with as I'm looking down the list of names and titles in the space, in such an amazing company of people doing amazing work. So I'll pause there and leave some room for some questions.
I don't know if you can see the chat box, but people are pretty excited about everything that you're saying. And so I wish we had Travis and Elizabeth and everywhere, if they could be just, if you could clone you both and have you be everywhere. So I do have a couple questions. I'm sure Jennifer has a couple questions, but my first one, Travis, is I'm interested in the funding model for this. So where's the money coming from? Let's start with that question.
Yeah, it's a very good question, and a very important question, because at the end of the day, the challenge around early learning is it's a money problem. It's a money problem. So much of it is a money problem, right? Unlike our K through 12 systems whereby we have a model for funding it through our taxpayer dollars. We don't really have that for early learning, as everyone knows, right? So we're patching together private philanthropy. We're adding to that corporate philanthropy. I don't know how many of you are from Nashville or know about Nashville, but it's the it city, and we have tons of corporations that are moving here. And one of the most important factors that they think about is what's childcare like? What's the education system like? And so inviting them to invest into this space has been really important, and we've had some takers. Bank of America has come in with some amazing support, and then our city council has voted a significant amount of funding to support this work. And this is a radical move for our city. It's an important move for our city to invest, millions of dollars into what is a very, very disrupted system. COVID has exacerbated or laid bare the challenges that we already knew were there for everybody, but especially in communities of color. We're talking about Black communities. We're talking about the Latin community, and our city council has also added to this support money for us to focus on the Muslim community. And Nashville has the largest Kumanji Kurd population in North America, and so there's a significant group there to focus on. And so we will continue to piece together and tether together funding sources, both at the local, state, and national level. We're working with some national partners now around more funding to support that universal basic income piece.
Jennifer, I didn't know I couldn't tell if you had a follow-up.
Yeah. Gosh, there's so much to unpack there. One thing, I saw a request for your email, Travis, and I wanted to share that in partnership with the National Center on Early Childhood Quality Assurance, we have these monthly Friday family childcare conversations. They're a little bit different than a webinar format because they really are just these informal conversations. And certainly we would love to connect Elizabeth and Travis into those conversations if you'd be willing. So for folks that are eager to connect, that would be one way, and we can drop the information about those Friday conversations in the chat. Oh, thanks. And thanks for putting your email in there, Travis. Okay.
Those chats are a great way for you to just connect with people across the US and territories to talk about family childcare issues. So we'll make sure that Travis and Elizabeth are clued into those, that people can join. And thank you, Tatiana and Ashley, for putting the links to register for those conversations in the chat box. So this idea of, go ahead.
Laura, if I could jump in, and I was just getting ready to speak to it when the question came through, just talking about outreach, such an important aspect of this, as Elizabeth has talked about, right? So our strategy and approach towards outreach really is a grassroots oriented approach. It is knocking on doors. It is meeting people. What we, in general at Rafa Institute, what we understand to be what we call the super highway of transformative change, relationships. It's core relationships and building core relationships. It is getting with the people where they are. And because of the story of the providers that we are serving, because of their story, both currently and historically, we're talking about people of color in the urban South. There's a particular story associated with a Black woman in that space, right? It is important for us to get in shoulder to shoulder, arm in arm, hand in hand, door to door with them, sitting with them and inviting them into this space, right? And walking with them in this space, not so much as a high level program per se, but really as kind of person to person, relationship to relationship. So that is a very significant and strategic part of our engagement. And we think it's a piece that, one, talk about sustainability and retention. We think that is in part what tethers tethers people to the work for the long term, right? They're engaged with a human being beyond just a program, right? And that's how it started. It started that way. So very important part of our strategy. Maicha, thank you so much for correcting your email. Please forgive me.
So one of the questions that came up in the chat box was about additional resources or case studies. So hold that thought, because we're going to give you a ton of links and additional resources. So Christopher, hold that thought for 1 second. In fact, Tatiana just put some resources on the slide. So these are all resources. We'll also throw links into the chat box for you all. Some good basic resources, kind of the resources we say are must reads for people who are considering staff family childcare networks as an opportunity to grow your quality supply of early care and education. So we'll throw some of those in the chat box, and I'll have you hold on that slide for a minute, Tatiana, and we'll also talk about the website. But I want to make sure we're also getting any questions in the chat. So Travis and Elizabeth, I think I heard this, but I want to make sure I say to everyone. So there was a combination of ARP dollars for both of you. You used federal dollars as well as philanthropy dollars, private dollars. So you really did find a way to kind of bring every possible resource to the table for both of your programs. Did I hear that right for both of you? Okay. So another good example of how people are leveraging this amazing commitment we've had from the feds around dollars to support early care and education. So thank you for that. I also wanted to highlight two other.
Laura, if I could just speak very briefly to that, and this is, talking to the significant number of folks here who are thinking about starting this, and I imagine, wondering where's the money going to come from, probably is the thing that remains on your mind, because it remains on mine. But I want to encourage you that, with the hope that lots of people are interested in this problem. And what we're finding is that they are not hesitant to give money. They're hesitant to give money to something that they're not sure works. And I think this provides a kind of model that people can really believe in. They can see it. They can see how it adds to the fabric and to the landscape of early learning in a city or in a location. So I would say be encouraged with the idea that people are ready to give. People, both as private donors, as corporations, as governments, they are ready to give. Put your stuff together and step on out there and then tell your story. Have a good reason why you're doing it. Tell your story. Tell it to as many people as you can. And I believe that the money will come. So I just want to encourage you with that. If we can do it, honey, I know you can.
Thank you for that. And it is, and again, thinking about the federal investment, it's a good, and people are always saying to us, but sustainability. The federal investment's an opportunity to incubate ideas, to pilot ideas, to get things to that stage in the implementation where you're not fully implemented, but where you have good data so that people will invest for the long term. So really think about how you're leveraging these dollars to jump in and get something started and start collecting data. And again, two things I think both of you have highlighted that I think are important as we think about quality and what our young children deserve is the benefits of licensing, the benefits of regulated care, not only in keeping people healthy and safe, making sure that there's curriculum, making sure that people have the professional development they need to support children's well-being, but it also the benefits that come with that and the other funding streams and the opportunities to participate in the quality initiatives in your states. Those are all big benefits, and you need to get in the system and be recognized and be counted. And then this other thing that I think is really excited about both of your programs is this idea of monitoring and regulation and coaching, and how those things can be blended. How it is possible for me to come in and say, I'm here to monitor your program, and there are some things that we need to work on, and I'm here to make you successful. So I can be someone who has to help you get things together, but I can also be a trusted source to say, and I'm here to help, let's get it going. So this kind of marriage between the regulatory monitoring and coaching, it's super exciting for us to hear those conversations. So let's go to this next slide really quickly. So additional resources. So this is what the Office of Early Childhood Development's website looks like for a really beautifully curated group of resources for the workforce. And you'll find it covers a lot of things that are about the full workforce, but it does narrow down into family child care home-based providers. So this resource has really great things around wages and benefits, compensation and career ladders, PD and higher ed, those expanded services, that tab, that little box you'll just click on, that's going to get you to the Family Child Care Network resources that are curated there. And soon on this website, we're going to also post, because somebody asked this in the chat, some really good innovations. What are people doing? What are some case studies? What's happening across the country that you can look at and say, well, that area is very similar to my area. I should really dig deep into that. And remember that through your federal TA system, you can access peer-to-peer conversations, you can access supports for your initiative. So if you're not connected with your state office, your territory office of early care and education, connect with them and think about how you can access federal technical assistance, because there are a lot of us, even on this call, who are ready to support you at no cost. Next slide. Okay, so we have about 5 minutes, Jennifer, in case you have any questions, or Shana, in case you have any thoughts that you wanted to add to the end. Again, we want to thank our presenters for being here, for being not only articulate, but enthusiastic about this work, and for providing some innovations for us to think about. So huge thank you to those. We also would love people to, as we're winding up, fill out this quick evaluation. We're really wondering, how beneficial are the webinars that we provide for you, and how likely are you to use the information that we've provided? So we would appreciate you filling out that evaluation poll. And with 4 minutes to go, any last thoughts in the chat box, or from our presenters, or from Shana?
Laura, I have one quick thought, and it was a thread that I heard in, I think, all of our remarks, but this idea of connectedness and storytelling and data. And I think what's so powerful about venues like this today, or the Friday conversations that we mentioned, and other opportunities, is the more that we can share our own stories and the more that we can learn from one another, the more we're building our case. And so I'm just so appreciative of hearing from Travis and Elizabeth today, and being able to share a little bit about All Our Kin, and seeing all the energy and ideas in the chat too.
Yeah, Jennifer, I mean, you're right. There's a lot of great research going on from OPRE around this. And so sharing our stories with researchers is so important in getting it published. Yes, this webinar is being recorded, and it will go through 508 compliance. And then get posted on that website that we've been sharing the link for you. So you can go back and listen to it and access it, and make sure that you have all the great resources. You'll get an opportunity to not only listen to the recording, but also pull down the PowerPoint as well. So give it about a week and a half for us to get that posted. And then you can go on and find that posting.
I wanted to highlight the immense value, and I'm not saying it just because Jennifer's here, but the value of having technical assistance, especially for being new in the space. As I shared with you, Rafa Institute is a multi-service organization, and so having someone like All Our Kin who's got water under the bridge in this space to kind of walk you and guide you and provide materials and support and so forth is so important. So I would say certainly identify, some space where you can get that if you're looking to, get this kind of thing off the ground. Get that technical assistance, get that support, get that training, have that, body that can check in with you, once a week or every couple of weeks, and somebody who you can lay your woes on and say, this is not going so well, and get new ideas. And the other thing I wanted to press on is, one of the things that we're trying to do as we execute, is to remember to be the friend to our providers, especially if you're working in communities that are marginalized and are historically oppressed. There is enough fear and antagonism and experience with that. Don't add to it. Be the friend, be the bridge, be the advocate for those providers, because they need that. The system already, in many ways, can be built against. Be the grease in that space. So those are just two last bits of encouragement I want to offer.
Thank you. Again, thank you all very, very much. We appreciate everybody's time and commitment to our home-based providers. Elizabeth and Travis and Jennifer, thank you for sharing your wisdom and the work that you're doing. It is so great to always have opportunities to hear from you. Thanks, everybody. Have a great day. The recording will be posted in about a week or so.